Welcome to Healthy Buzz, the podcast for women who are craving honest answers in a supported community. Hosted by Brandy Homerding, a certified nutrition therapy practitioner who believes your body isn't broken, but the narrative around women's health is. Each week, we're diving deep into holistic health topics, challenging the one-size-fits-all approach, and empowering you to trust your own informed intuition. Get ready to feel seen, supported, and seriously informed. This is Healthy Buzz, where collaboration meets unfiltered transparency in women's health. Hi, Healthy Buzz listeners. Today, I am joined by Fawn Coussens of Kinetic Physical Therapy to talk all about pelvic floor health. Fawn has a master's in physical therapy and a bachelor's degree in dance and movement physiology. With a passion for teaching and physical education, she loves working with people's movement and body awareness, as well as muscle balance and activity-specific training. She has subspecialties working with the pre- and postpartum women, pre- and postmenopausal folks, pelvic floor rehabilitation, and multi-sport athletes. Fawn has a holistic, patient-centered approach to patient care. She believes that our bodies are not defined by their injuries or restrictions and should honor their capacity. When working with patients, she incorporates assessment of restriction and impairments involving the muscular, joint, craniosacral, neuro, and organ visceral system. Fawn enjoys balance in her life through snowboarding, stand-up paddleboarding, multi-sport training, and listening to play-by-play baseball while cooking with her friends and family. Fawn, welcome to today's show.
Thank you so much, Brandy. It's so exciting to be here.
So Fawn is also a West Seattleite like myself, and that's how I met her. And I'm really excited to share a little bit more and learn more from Fawn today as we talk about the pelvic floor and why it's so important when it comes to women's health. So Fawn, to start off, how did you get involved with physical therapy and pelvic floor health?
Physical therapy, I got involved with through a snowboarding injury in my 20s. My undergraduate, I thought I was going to be more on the nutrition journey. Then I started personal training and started really loving the physical side of things, but didn't really know what that meant. And so I ended up just kind of spending a lot of time traveling and working in restaurants and traveling. And at some point in that journey, I stopped in Amsterdam where a girlfriend of mine was in physical therapy school. And that just set off all of the alarms for me and interest. And then I came home and broke my shoulder and was sent to PT. And then that was it. So went back to school. And now 25 years later, here I am.
I love that. I find that so many people have a personal story that sets them on the journey to what their career involves. Yes. Why pelvic floor health? Why is pelvic floor so important? Why does it matter?
I love that question because it wasn't something that I came to ease with early in my career, I should say, simply because I'm a female in the society we're all raised in, I think. I was lucky enough to early in my career be working with and among some really incredible therapists who are super passionate and curious and creative. And some people who are really leaders in our field generally, as well as locally. And because of that, I was in contact with somebody who was a very early driver of pelvic health PT named Kathy Wallace. And she had done some continuing education in our clinic where we talked a lot about doing pelvic assessment externally through your clothes, easy stuff that you could do in an open gym in a physical therapy clinic. Because I, like many people, it seemed scary to do something that was going to be internal, like when you have an annual exam. And I just wasn't in that place. And once you learn something, it's hard to not see things everywhere in that way. And so it unlocked so many different questions that I would have about folks who maybe weren't healing in the way I expected, or I thought I had looked at everything, but just wasn't necessarily catching everything, or they just kept coming back with their pelvis, quote, out of alignment or something like that. And learning about the pelvic floor helped to completely open up the three-dimensionality of the pelvis. I mean, I was literally missing an enormous part of what was happening in the pelvis. And then the more I've learned about the pelvis, about the pelvic floor, the more roles I appreciate that it has in the body. That experience was about 23 years ago, a long time ago. And it was only 10 years ago that I did my training for internal pelvic work. At a certain point, it just felt kind of inefficient to feel like we would get to a certain place with somebody's recovery and feel like, oh, I'm pretty sure the pelvic floor is the piece here, then I'd have to send them out to somebody who specialized in pelvic floor PT, wait for them to, go through whatever they needed, come back, or sometimes we would, interdigitate, what we were doing. And so at a certain point, I just felt like it was time, I was ready. And so then I did my training with Kathy, and that's just changed so many things for me. So now we can do everything. If we have that question, if that comes up as why somebody's maybe their hip or low back pain or something that didn't seem otherwise like a pelvic floor driven thing initially, we can turn that page, or we can just have these open conversations for when people might feel ready down the road. Then I have the blessing of working with folks who know that they've got a pelvic floor involvement, and I can normalize that and I can integrate that in the rest of their system so that people can understand how that just easily weaves into everything else in their body.
Wow. Can you define for the listeners, what do you mean by pelvic floor?
So the pelvic floor is a group of muscles that line the inside of the pelvis. It's like a bowl shape. And the muscles are maybe like a trampoline or a sling that attach from one side of the pelvis to the other and front to back. And they mirror our breathing diaphragm. So the pelvic floor creates a diaphragm within the pelvis, and that mirrors the shape of our breathing diaphragm up under our rib cage. And there's several different muscles within the pelvic floor themselves. And functionally, we often look at it in PT as a superficial, intermediate, and deep layer because they have different functions by and large to them, and they have different roles in terms of what they serve within the pelvis. But it's a muscular sling like any of the other muscles in the body. They just have disproportionate roles in what they need to do for us.
So what are some of the roles of the pelvic floor in the body?
So the pelvic floor is a huge component of our core and support of our trunk, like the abdominal wall or the low back musculature and the psoas. It is a huge component of what we would think of as our core when we're training our core. A huge amount of structural support. It is largely responsible for helping to maintain bowel and bladder regulation and continence, and sexual function. Has a huge role in pleasure and desire, orgasm, things like that, and circulation and many other things like that. But the three things I'll often address the most are sexual function, bowel and bladder control, and structural support.
That's really interesting how it's more involved than what a lot of people think. A lot of times people probably think their pelvic floor is just I don't even know what people think their pelvic floor is, but there's so many roles. Can you speak a little bit more about how it impacts maybe sexual function or even bladder control? Maybe we can talk about all of these points. How does it specifically impact sexual function?
I mean, there's probably many answers to that question, but often some of the most common reasons that I'll see folks under that umbrella in the office are with decreased orgasm, either decreased strength in orgasm or difficulty achieving orgasm. Probably those are the main things in terms of pleasure. I would say desire kind of comes driven through a little bit of a different system, but also the experience of pleasure is not just in terms of clitoral stimulation or stimulation to the tissues, but also the ability to have enough secretion and lubrication and things like that so that it's not painful. So that a lot of that comes through the pelvic floor in terms of circulation, how robust the muscles are to be able to create a slippery environment and to make sure that the glands that secrete fluids are open, the channels are open and things like that. But those things can be impacted. Well, lots of things can impact them, trauma to the pelvis, a fall, uncomfortable speculum exam, other unwelcome trauma to the pelvis, things like that. Falls on tailbone are really common, but also childbirth will impact that through just generalized trauma, or sometimes, baby will get wedged in a certain spot that creates a strain to the muscle. And trigger points that are, come after delivery and then in menopause, or perimenopause and into postmenopause when the tissues just change so significantly. So all of that can impact sexual function.
Hey, Healthy Buzz community. Have you been curious about using a continuous glucose monitor to unlock powerful insights to your metabolic health? Imagine seeing in real time how your body responds to different meals, different workouts, and also the effects of stress. Now, what if you could experience those benefits without being locked into any type of recurring subscription like some of the other continuous glucose monitor programs out there? With my Blood Sugar Savvy course, you'll get exactly that. You'll receive access to 7 engaging learning modules, 2 continuous glucose monitors to start your wellness journey, plus 4 weekly one-on-one video strategy sessions with me where I'll personally guide you to understanding your CGM data. We'll work together to identify your unique blood sugar patterns and create customized strategies for better energy, mood, and overall well-being. Oh, and by the way, this is especially crucial during your peri and postmenopausal years. Blood Sugar Savvy is about understanding your body on a deeper level, implementing practical strategies, and gaining sustainable knowledge to support your overall health and wellness. Ready to get Blood Sugar Savvy and take control of your metabolic health? Healthy Buzz listeners can save $30 simply by using the code BUZZ at checkout when you enroll at bcw.bcollectivewellness.com/blood sugar savvy. That's bcw.bcollectivewellness.com/blood sugar savvy. Don't forget to use that code BUZZ at checkout for your $30 savings. Your personalized blood sugar journey starts now. I want to put a pin in that and we'll come back to the perimenopause and menopause conversation.
Yeah, for sure.
But I also want to talk about the other ones that we talked about too, the like incontinence and the pelvic floor and incontinence situation, bladder control. How is that impacting that? Because sometimes people are just like, oh, I had a baby and so now I just have this incontinence issue or something to that effect.
That kind of falls under the heading of just because it's common doesn't mean it's normal for me. And it is common. I mean, childbirth is extremely traumatic. That goes for even if you have a cesarean delivery that is planned, where there's no labor that you go through or no attempted delivery or anything like that. When you disrupt the fascia around the pelvis and lower abdominal wall, and through the stretch of a pregnancy, but when you have either a cesarean or a vaginal delivery, it's very traumatic to the pelvic tissues because of the physiologic changes that they undergo. You can get dysfunction in the pelvic floor musculature. And so when you get either through childbirth and delivery or things like that, if you have changes in the pelvic floor muscle tension and function, you can get overstretch of those muscles. You can get tearing of those muscles. You can just get trigger points from the strain of the procedure or the process. And so those muscles can either become kind of downregulated and get a little bit loose and lengthened. And along with that comes weakness. Or more often the case, they either get imbalanced or just all upregulate and get really tight. And as a byproduct of that, also will perform as the weak. Something that's really tight will translate to functional weakness quite often. So then you're not able to support the bladder and all of that.
Right. A lot of times people think with like bladder dysfunction that maybe their muscles are too weak, but maybe they're too tight as well can have a big impact.
Yes, probably one of the most common misconceptions about the pelvic floor is that if you have leaking, you just need to do more Kegels. And that can either lead people to wasting a lot of time doing exercises that aren't going to serve them, or even worse, make their symptoms worse. If there's somebody who has a really upregulated, tight, clenching pelvic floor and they think that they need to do more Kegels, they'll start increasing the tension of their pelvic floor and make their symptoms worse, and then sort of think that there's no hope, but there's just so much that needs to happen. It's just they probably needed to go in the other direction.
Interesting. We're all learning so much about that. So Kegels are not always the best thing that we should be doing.
Right.
Probably get evaluated by a pelvic floor physical therapist instead.
Right. Yeah. Specificity is really important. Mm-hmm.
Mm-hmm. So what is the impact then when we think about like GI health when it comes to the pelvic floor?
Yeah. By and large, as a generalization, I'll say if folks have trend towards diarrhea in their constitution, they will often, as a side effect or byproduct of that, have an upregulated pelvic floor, because when you have really loose stool, your body's natural tendency is going to want to be to clench the outlet so that you don't leak. You don't, have an embarrassing situation potentially. And so that's usually what I'll see, is that somebody who tends toward having diarrhea will have increased tension in their pelvic floor to manage that. Conversely, if somebody has increased tension in their pelvic floor for any number of reasons, that will often drive constipation because effectively, like, the trap door is closed. And so people can't eliminate.
Okay, so yes, pelvic floor is going to have a huge impact when it comes to our gut health. And something I'm really passionate about as well is helping women understand their symptoms. So what Fawn does with understanding like the structural of what's going on in the body. I'm also looking at like what's happening with digestion overall, the microbiome, how we're eating, how we're absorbing our nutrients, because both of those things are going to play a huge role when it comes to gut health. And I will say too that I have quite a few clients that I will be like, I think you'd be a great candidate for some pelvic floor physical therapy. Let's get an assessment. Let's see like what's actually going on structurally so that what we're doing with all the other rebalancing of their gut microbiome is having a positive impact overall. It's more than just like one piece of puzzle. You know, health and wellness is not just like one drop in a bucket. It's a collective of things that we have to think about.
Absolutely.
So let's go back to that conversation that we had with changes when it comes to peri and post-menopause and how that's affecting the pelvic floor, these changes that women are experiencing with their hormonal transition. How does that impact pelvic floor health?
There's many ways that happens, but chief among that is that because the skeletal muscle in the body really relies on estrogen for its robustness and for the muscles to be able to maintain strength and function. With the precipitous decline in estrogen through peri and then into postmenopause, the pelvic floor gets disproportionately impacted by that, because like all skeletal muscle in the body or all muscle tissue in the body, it is reliant on estrogen. It has so many roles and has to support our structures from the impacting gravity. So it ends up having almost disproportionate burnout, I think, with the decline in estrogen. And so it sees a lot of structure and function changes, and the tissues themselves can become stiffer, less resilient. If you had some predisposing pelvic floor issues through any number of falls or, issues leading up to perimenopause or postmenopause that you might have, what I would say, sort of gotten away with, up to that point, when you have that decline in estrogen, the tissues just can, at a certain point, often just can't tolerate, what the body needs of them. And so then they start showing their colors at that point.
What are some of those symptoms that people might be experiencing, and what is your body like showing us?
Yeah, some of the most common things that I will see is vaginal dryness, painful orgasm or difficulty achieving orgasm, pain with penetration. A lot of cyclists will have a feeling of like rashy itchiness sitting on the saddle and things like that. And so your tissues can feel really scratchy and dry, both externally around the labia and the perineum as well as internally. Sex becomes really uncomfortable. People will start sometimes they'll have prolapse symptoms that they might not have had previous to that, or a worsening of pelvic organ prolapse. And we can come back to that if there's a question on that, or if you want to look a little deeper into that. Increased digestive symptoms, so constipation that might not have otherwise been present will often happen. And then, of course, leaking, either difficulty, like more of that sort of nervous bladder feeling, like feeling like you always have to just in case pee before you do anything. And when you go, there's just a little bit, or feeling like you have to pee, but you can't get it out, or feeling like you need to strain. Those are really common symptoms at this stage of life.
Can you explain a little bit what like prolapse means and what that might look like for somebody who is dealing with that?
Yeah. So pelvic organ prolapse is when the tissues that are usually held internally up in the pelvis start to kind of descend through usually the vaginal canal, but sometimes rectally as well. That might be your urethra, the bladder, your uterus, and then sometimes also your colon or your rectum can start to herniate into the vaginal wall. That sometimes just pushes into the vaginal opening, but sometimes it'll actually even come out through the vagina, or sometimes the rectal tissues will come out through the anus themselves. And that can be felt in different ways. Sometimes people will have symptoms of like a heaviness in their pelvis. Sometimes it'll feel like they have a tampon that's falling out, but they're not using tampons anymore because they're not menstruating, but it has that like feeling of like something chafing in there. They'll go to wipe and they'll be like, ooh, that feels like something that I'm not used to being there. There's something sticking out. Or they might feel like they have to like stuff something back up inside. That might happen when they're going to the bathroom. That could happen through, fitness and things like that, where they're up and around more. And sometimes they might not notice any of those symptoms, but it's painful when they're having penetration and lubrication isn't the problem. Sometimes prolapse isn't at all symptomatic, but sometimes it can be really painful.
What are the options for somebody who does have prolapse? Is it like a surgical procedure? Is it really just working on pelvic floor health? Like, is it a combination of treatments? What does that look like?
Oh, it is totally a combination of things. Sometimes surgery is the answer, but even then, and I am so biased towards physical therapy, but I would say even then, physical therapy, I would hope would be a part of their treatment plan, because prolapse can come from lots of different drivers, but because our connective tissue also changes in the landscape of childbirth, but also in the landscape of menopause, the fascia gets really lengthened and stretched. And so things that might have suspended those organs up in place start to kind of get more lengthened and stretched out. So the organs then kind of droop down in the pelvis. So pelvic floor training is a part of that, but there's also a ton of training that PT can be involved with in terms of looking at hip structure and function. Breathing is really important when we're talking about prolapse. Pressure management is extremely important. What we do with the internal pressures in our body, how we manage our breath, making sure that we're not straining to go to the bathroom, we're not bearing down, we're not holding our breath from a stability strategy, but also not forcing bowel movements. Or if we're having difficulty starting urination, we're not forcing that, because every time you do that downward pressure, you're sort of restraining that. So PT is a really big part of identifying what the missing pieces are. Is it a fascial problem? Is it a muscle insufficiency problem? Is it a pressure management problem? Or is there stiffness somewhere else in their body that is forcing sort of a path of least resistance in their pelvic organs? A lot of times rib cage and thoracic stiffness plays a big role in that. And so we need to increase the shock absorption elsewhere in their body so their organs don't become so mobile.
Interesting. That is so fascinating how, like, the body, it sounds like it can compensate a lot for things that might be out of place. And then that compensation leads to other problems, which we know always happens.
Yes.
And also, like, the surgical approach can be beneficial, but it's also, we got to look at, like, structurally, how can we support that procedure to continue to have the support that our body needs overall? Otherwise, it's just a Band-Aid approach.
Right. Yeah. If their strategies are a part of what triggered the prolapse to begin with, they'll have the same strategies with a bladder sling. And so then they might be ineffective. And that can be emotionally very traumatic for people to undergo a procedure like that and then have the same problems down the line. So we can work either in tandem with repair, or sometimes help people avoid that altogether.
Good. Awesome. Amazing. So everybody make note of that. If you're having difficulties, find somebody like Fawn to help you out and navigate the next steps through that. It's part of the healing journey, right? We see so many people who have surgery for different things, let's say like shoulder injury or knee injury, and they get PT. I wonder if it is standard to have pelvic floor PT after.
Yeah, that'll really depend on the surgeon. I would love to say so, but I mean, I think that really just depends on who you're seeing and what their exposure is and what that professional's, sort of opinion is. A lot of times patients need to sort of drive their own referral for physical therapy. And then at that point, most of the time, the surgeon will be like, oh, sure. They just don't necessarily think about it. Their surgery was a success because the bladder's in place, but they are not thinking about, some of these other elements. And some surgeons are extremely savvy and know that the best way to facilitate long-term positive outcomes is to have a team approach. And so it's just helpful for patients to drive that question and make sure that that's in line.
Yes, advocating for ourselves as patients is so important. And don't feel like you're going to be stepping on anybody's toes. This is your health. So definitely speak up, ask questions. Like, is this part of something that they would recommend? If it's not, can it be something that you want because you've heard about the benefits it could have?
Mm-hmm. Absolutely.
So when we're thinking about a strong core, Why should we consider the pelvic floor as part of that core? Because sometimes people think like core, they just think about like six-pack abs. Or like the core is so much more than that.
Yes. Yeah. Even thinking about having a strong core is sort of like we want to add more to that because your core is really sort of everything involving your trunk and pelvis. And so there's functionally in PT speak, we would say maybe there's an inner core and an outer core. But regardless of, how we phrase it, it's important that the musculature, deep, intermediate, and superficial around the trunk, the front, the back, the sides, the bottom, and the top are all performing well, that they have the ability to create appropriate tension and timing, and they have the ability to elongate and shorten and move. And so if we're just focused on six-pack abs, for example, that might be just creating stiffness in one area of the body. That could be at the expense of elongation and mobility, or it could just be, one dimension when what we need is many dimensions of support. A lot of times I'll see people who have, kind of the classically aesthetic, incredibly beautiful abdominal wall where, they're super chiseled, et cetera, but they have unbelievable urinary incontinence because with all of that muscular stiffness and definition comes a path of least resistance down through the pelvis because their body can't elongate, stretch, and move through the trunk as well because of how all the stiffness developed by the muscle development in their abdominal wall. And so balance is the key. It's having the ability to tension all the musculature around the trunk at the right time with the right amount of tension for the specific task at hand. And what you need to sit comfortably is different than what you need to play rugby. It's different than what you need to swim or just walk down the street or push a stroller up a hill and all that kind of stuff. And so there's a lot of specificity to it. But the pelvic floor is a really important piece of that because it helps to keep all of the parts of the pelvis together. It keeps our organs all up inside, and it allows for shock absorption and passage of fluid through the pelvis and transition of shock and force from one side of the body to the other and from above and below. So it's a huge force transducer in the body.
Wow. Thank you for explaining that. It was like so well described that
Oh, thank you.
we can see that, I think Fawn is just saying like we need to stop trying to get six-pack abs and think about strengthening the core all around in all dimensions, not just the front and what we see aesthetically pleasing, because we got to work the core in the back, the core, the pelvic floor, all of that as well.
Yeah, it's appropriate training.
So let's say, because a lot of times people think like, and we have mentioned this, like childbirth and carrying a child, or even if you have a C-section, is going to definitely do some trauma to the pelvic floor. What about people like me who have never been pregnant and don't plan on getting pregnant? How do we need to be concerned about our pelvic floor? What are things that maybe are making us more susceptible to some pelvic floor dysfunction?
Because the pelvic floor, it's so key to what happens in moving force from one side of the body to the other and above and below. Almost everything energetically will pass through the pelvis. A lot of people have like big toe injuries, for example. They'll get stiffness in their big toe, and then they'll be walking around with pain every time they roll over their big toe, or knee pain, or pinching in the front of their hip so that when they walk, they get like a stab in the front of their hip as their leg passes underneath them, things like that. Because it's often painful with every step that they take, their body will naturally learn how to kind of put on the brakes a little bit as they step down so that they're mitigating those forces. And a lot of that protective mechanism comes through the pelvis. And so your body starts to anticipate, oh, we're going to take a step. It's painful on the right. So you might just tighten the right side of the pelvis. And so your pelvic floor starts to just sort of like insidiously or, kind of secretly start to tighten up. You're not aware of that necessarily at the time, but it's just a part of your body protecting you by trying to dampen some of the forces so that your toe or your hip or your knee or whatever doesn't have to go through that. Let's see, other examples of just like so many orthopedic injuries will involve the pelvic floor. If you are on your bike and you fall on your hip, some of your hip muscles are pelvic floor muscles, and some of them share fascia but aren't directly involved in the pelvic floor themselves, but it's on one side, on inside or the outside of the same pelvic bone. So any injury around the hips and pelvis can have direct impact to the pelvic floor just because those muscles will shock absorb. They're inside, so we don't see them. You might see a bruise on your hip, or you might, know that you tore your ACL or something like that, but you're not as aware that you're compensating within the pelvis because it hasn't yet shown up symptomatically for you. But if you show up in menopause, for example, all of a sudden having what seems like spontaneous pelvic floor issues that you didn't notice before, you can often look back and see, oh, there was that ankle sprain that I just compensated for, and it changed the mechanics of my kinetic chain, up into my hip, or I had that bike fall, or, I had that, if like me, a snowboarding, oh my gosh, how many times a season do I fall on my tailbone snowboarding? And so that just kind of builds in the pelvic floor.
Interesting. Yeah. And another thing that I just thought of too is when we talked about earlier, like some surgeries that maybe we talked specifically like around a bladder sling or prolapse. What about a hysterectomy?
My gosh, yes. Because, when you are having a hysterectomy, partial or complete hysterectomy, so whether or not you're just taking out the uterus or you're also taking out fallopian tubes and ovaries, they're couple of things. One is those things occupy space in the pelvis. And so when you take out those organs, other things kind of slosh into place because your body's not going to just sort of hold this open space, a pocket of air where that organ used to be. So now you have sort of changes to the inner landscape. Your body has to adjust to that sensory wise. But there's also musculature and ligaments that attach in and around those structures. And so they will often have to be change. So you'll have sort of some inner changes where the ligaments that would have attached to the bladder might be secured somewhere else on the pelvis. And so that just creates changes for what your body is accustomed to supporting. And so sometimes that will also lead to pelvic pain issues as well as prolapse or things like that of other tissues, or just pelvic floor tension imbalances because your body's having to cope with these new changes.
Yes, that makes a ton of sense. Like if you
Yeah.
take something away, something needs to fill its spot.
Yes. Yeah. And anytime, on my health history, I am interested in hysterectomies, even if somebody is coming to see me for something they don't think is related. They might have headaches or low back pain or something like that. But if I see a hysterectomy as a part of their past medical history, I might not assume that they have a pelvic floor issue, but it's in my mind that we might be having a conversation about the pelvic floor to some degree based on knowing that those procedures can impact their pelvic floor. It doesn't always, sometimes people will have a cesarean or have a hysterectomy and their pelvic floor is fine. But I also want to entertain the possibility that there could have been changes that we'll need to address.
Do you, and just like a hypothetical question, because I know you don't know the exact answer, but like if somebody has really worked on supporting their pelvic floor prior to like a hysterectomy, do you think that they would have better outcomes?
I would think so. I mean, same thing. I think people who come to PT when they're pregnant or, pre-delivery, the more prepared your body is going into a procedure or an experience, usually, the better it's going to do on the other side because the tissues are prepared for it. Your strategies are in place and things like that. I mean, anything can happen in those, circumstances, but we can be better prepared and also just be sort of in healthy relationship to our pelvis and have this understanding of, what things can change. A lot of times, it's such a private area of the body. There's so much societal, pressure and shame and all of that. So the more we can kind of develop a healthy understanding and a relationship to that area of the body, I think that the less emotionally traumatic those things can be and the more we're like ready for accepting what comes.
Yeah, that makes a ton of sense. What about pelvic floor health? And when you think about like somebody in their fertility journey, like they're wanting to get pregnant, maybe they're having difficulty getting pregnant. What role does like pelvic floor health have in that?
I love that question because I think that people don't realize necessarily how much PT can be beneficial in fertility. There's a couple of really significant ways in which pelvic PT can be really beneficial to supporting fertility. For example, if somebody has an upregulated pelvic floor, they have tension in their pelvic floor, lots of tension, they have difficulty relaxing or releasing the pelvic floor. that creates a crowding in the pelvis. All of our organs need to be able to move within our body. They're free moving, like our head can bobble around. Our organs can kind of bobble around on the inside. That allows our stomach to fill and then empty. And it allows, our digestion to happen and all of that. These things need to move around. And the same goes for our pelvic organs. Our uterus needs to be able to move up and down, side to side, just a little bit, but it needs to be able to be easily mobile and then be able to expand and grow. And so if you have a lot of excessive tension of the pelvic floor, then that sort of crowds that space a little bit. And it's on a small level. It's not like it's going to crowd out the uterus, but your body can be highly sensitive to restrictions in any ways. And that can sort of feel maybe like your uterus finds that an inhospitable environment. And so it might just sort of choose to be a little cranky about that. And so that can sort of get in the way with receptivity of those organs. And that might sound a little bit of woo-woo, but I'm okay with that.
We're here for the woo.
I know. A lot of times folks who are having difficulty with fertility, either leading up to this or as a result of it, will have greatly increased stress. And it's something they've maybe dreamt about, or maybe it's just something they've had a change of heart about and they're newly excited about it. And then it becomes this disappointing and sort of like a boom and bust kind of experience where they get so excited and they're so deflated. And so there's a lot of pressure on that. And that tends to increase tension around the pelvis, and it tends to change our breathing patterns, which increases the stress. And so it's a cycle that goes around where we end up more in a state of stress. We're not breathing as fully. So we're not fully creating the nutrition to those tissues that they need so that they can be the most receptive. So increased tension in the pelvic floor, increased tension or decreased utilization of the diaphragm can really impact fertility, but also tension around the hips and around the tailbone and all of that can tighten the structural place in the pelvis called the obturator foramen. And so it's a place, the obturators, and then a little bit up, there's connection between the hips and the fascia that surrounds the fallopian tube and ovaries. And so you can create tightness or imbalances around that area that might make it hard for that egg to kind of go through the fallopian tubes. And then sometimes people have, just for whatever reason, have like a little twist in their fallopian tubes, or their ovary is squashed for some reason. Maybe they had a fall and it got jostled, or maybe they have had an injury to that hip that's impacted it. So PT can be really helpful for working on those structures. And then also just working at a visceral level. There's a lot of really gentle procedures that are just like through the clothes, through the abdomen, that can help reduce restriction around the organs in that area to help them be more mobile and open to receive.
Those are such good information. I think everybody needs pelvic floor physical therapy. We're all a candidate for it. In the beginning, you talked about being evaluated, and there's an internal and external evaluation. Can you talk a little bit more about what each of those looks like, external versus internal? And like, is there a time and place where you recommend one over the other, or what does that look like for somebody?
Yeah, I mean, a lot of the time, people don't necessarily have a need for an internal assessment of the pelvic floor, but we might want to get a greater appreciation for what it can do. And that can be external or superficial through their clothes. Always, 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 any contact with the pelvic floor is with information and complete consent. And so that needs to be on any sort of a continuum of what the patient is comfortable with. So we're always going to explain everything, that we think that they might have to expect during that. And at any step of the way, they need to be able to say, yep, I want to do this. And that sounds great. Or at any point they can say, actually, no, we're going to stop. And we stop. And that's it. That's really important. And so sometimes people aren't comfortable at all doing an internal assessment. And so what we do is do an external assessment. And that can be, by and large, the easiest way to do that is with them like laying on their stomach, and we can get an appreciation for what the pelvic floor does in terms of excursion, meaning how well it tightens. We can look at symmetry side to side, how it lifts, how it releases, and then how it lengthens. And then we do that by putting thumbs up at the sit bones and then just to the inside of the sit bones. So we can get an appreciation for what those tissues do. And there's a lot that we can do from there. If that feels like that's not enough or we need more depth and specificity, and the patient's open to it, we can always get a lot more specificity of information looking at the internal tissues. And so that is when we have patient undressed from the waist down. And it's a lot like having an annual exam. Initially, we'll do that laying on their back, just knees up and supported, and take a look at the tissues from there, looking externally as well as internally. And we can use one or two fingers to kind of feel what's happening with those tissues. We can watch what's happening when they bear down. We'll be able to see if there's prolapse and which organ, and we can get an appreciation for what's happening at the superficial, intermediate, and deep layers of the pelvic floor, the difference between the right and left and in the front and back. And so that we can get a much more specific take on which muscles are involved and be more specific with what their home exercise needs to be to sort of help correct that issue. But there's still tremendous amount that we can do superficially through the clothes. And like I said, kind of an open gym environment that can be really beneficial for all of the things that somebody might come in for.
That's so good to know that there's like a couple different options depending on somebody's comfort level. And like you said, the specificity, we are all different and unique individuals and we have very different needs. So having an expert like you who knows what they're doing is going to be really beneficial to that journey. So what are some tips when we're thinking about supporting the pelvic floor? What are things that we can be doing in our everyday life to really support our pelvic floor appropriately?
One thing is just if you are doing Kegels or pelvic floor contractions, it's valuable to make sure that you are feeling those muscles contract in the front as well as the back so that you're noticing tension around the vaginal opening, not just tightness around your anus. If you can't tell and you only feel tightening in the back, it can be beneficial to kind of lean forward and put your forearms on your thighs and bring your body weight forward so you're more sort of weight bearing over your labia. And then that will often helps to lengthen the back a little bit and bias you to be able to feel the front muscles contract. So that's helpful to get that balance of front and back. If you're doing pelvic floor contractions, make sure that in between each repetition that you relax so that you're not just tightening and then tightening more. Because if too much tension is a part of your pelvic floor issue, then building more tension isn't going to help you and it might serve you in the wrong direction. So we want to make sure that for every rep you lift, that you lower it. You know, you wouldn't put a dumbbell in your hand and do bicep curls and just keep your hand up by your shoulder and try and pump it up there all the time. You would curl it up and you would lower it down. And so the same thing goes for your pelvic floor. I always want somebody to have good rib cage mobility so that they're able to twist and rotate in their ribs and breathe fully into their ribs, into their pelvis, and into their belly as well as up into their chest. So making sure that folks have lots of good flexibility in the rib cage is really, really important. Reducing jaw clenching, because the jaw, you know, if you think about opening to our mouth and the opening to our anus are two ends of the same tube embryologically. And so our jaw and pelvis will often mirror each other. And sometimes the pelvic floor might be tight because we're tightening our jaw, and sometimes our jaw is tight because we're tightening our pelvic floor. But at any rate, they're in close relationship. And so working on jaw clenching, releasing that, it can be really beneficial. And breathing is probably the most important piece to, it's a sweeping generalization, but to absolutely everything in the body. I would say we often have imbalanced breathing patterns that contribute to whatever involvement it might be, if that's headaches or constipation or diarrhea, all of that, you know, it impacts our breathing patterns, impact that. If we have really shallow breathing patterns, then we're not going to be able to secrete the digestive enzymes that we need to help metabolize our food. We're not going to mobilize our organs to be able to pump the food through the pipes so that we can have a chance at proper elimination. And we're not going to get the natural pump that helps to move things down into our pelvis to keep the circulation and fluid through that area. So breathing three-dimensionally is very, very important. And that means breathing into the sides of your body, breathing into your low back, which always sounds a little funny to people, breathing all the way down into the pelvis and into the belly. But making sure that when we take a big breath, that we feel movement in the pelvis itself.
Wow. I remember when I went to my chiropractor, was it last year or year before? And I did have a PT evaluation. They're like, you're breathing wrong. And I'm like, how am I breathing wrong? I'm so offended. Like, I know how to breathe. No,
I've
I
been
was
doing this
breathing
my whole
wrong.
life.
Right? Been doing it for 43 years. Come
Yeah,
on.
right.
But yeah,
Yes.
the way you
Yeah.
breathe makes a
Yeah.
difference. And a lot of us are doing it wrong.
Yeah, I don't know. Language is important. I wouldn't tell you you're doing it wrong because you're doing it, you're getting by. I think that's really important. We do what we do for a very, very good reason, but sometimes those reasons, those strategies are no longer serving us and need to be sort of bumped off with a new strategy that like meets our needs a little bit better. So we can always be working on efficiency and effectiveness of what we do and just try and introduce something with love into the body.
Love that. Thank you for reframing that for me. So what about like when we think about like bowel movements and bladder, like anything that we should be thinking about to support our pelvic health when we're thinking about our bathroom habits?
Oh, goodness. Yes. When you go to the bathroom, elevate your feet. There should be a little stool by your toilet,
Squatty potty.
the squatty potty, or just get like a yoga block. Well, you kind of want the tall side of the yoga block, but like it could be just that little folding step stool that you get at True Value. Anything like that, just something that you can put your feet on, because that really helps to widen the pelvic outlet and it helps to release and relax those pelvic floor muscles. I am always delighted when I see something that I can put my feet on in somebody's, in a house that's not mine, but in all of our bathrooms, there's stools everywhere. That's number one. Number two, take your time. No rushing, not to pee, not to poop, nothing. Take your time in there and try not to bring your phone in, but bring paper to read or just do breathing when you're there. Just really focus on your nice, full, nourishing breaths when you're in the bathroom and let that be that beautiful and delicious time that you let your brain wander. We so seldom let ourselves wander and free associate. We are always kind of distracting ourselves with our pocket computers and with tasks. It's a wonderful time to just zone out and do nothing and protect that time and take all the time that you need. That's really important. And that's especially hard, I think, for socially trained females. And so whether or not, you're biologically a female or you're sort of feminine identifying, we tend to get socialized in a different way that like we need to get in and get out and start taking care of the next thing, but we deserve time in there and just take that time. And make sure that when you're in the bathroom that you're not straining, that if it's difficult to have a bowel movement, that might mean you need to take more time to let it kind of move through the chambers. It might mean that you're a little constipated and you need to kind of just get up and leave for a little while, drink some more water, maybe some warm water to kind of help soften and kind of soothe your system, move around a little bit so that things can kind of come back and you'll get a sense of urgency and then come back to the toilet and try it again when you have a little more of that physical sense of urgency. But avoiding straining is really important, especially if you're concerned about prolapse and things like that, because it puts more strain on the pelvic fascia. But it's also just an indication that, your body's not quite ready. And so like we shouldn't force ourselves. So take the time when you're there, feet elevated, and avoid straining when you're there. And then in a class I taught recently, I was amazed at how many people were so shocked at my notion that you shouldn't like blow your nose on the toilet. But like if you're sitting there and you're relaxing, the last thing your body really needs you to do is create more inward and downward pressure. And so just like the multitasking, we're so conditioned for that. So, I mean, if you do it now and again, you're not going to damage anything more than likely, but just, blow your nose and then sit down. That's okay.
One thing I thought about in some of this like social conditioning is like people avoiding pooping in public and ignoring their urges to go because, oh my gosh, I'm in public. And if I go, all these stories around it. And that's just going to lead to more pelvic floor dysfunction and constipation issues down the road too.
Yes. Oh, and these kids who can't go to the bathroom at school. And so it just is so hard. And they're like rushing to after school activities. And then it's like 12 hours their body's been telling them. And they're like, no, no, no. And then, my heart goes out. It's really hard because that's across the gender spectrum. That's across the age spectrum. That's everything. It's like every single body poops. Everybody has to eliminate, every single person. And so we just have to find a way to greater comfort with that, because it's so important and it's so healthy to respond to your body's need and just take care of that. And you feel better. You're not distracted. You're not agitated. You're not, you don't have like gas now building up and all that kind of stuff. And it's just so beneficial to take care of your body's needs when it shows up.
Yeah, we got to eliminate those toxins that are like in our fecal material instead of letting them like recirculate. And if you're like, oh my gosh, but every time I go, it smells so bad. Okay, then we need to talk. Come talk to me. Let's figure out what's going in your microbiome, because it shouldn't clear the room. You shouldn't have to light a match and like hope nobody goes in the bathroom after you. We can definitely work through that.
What's happening on the inside?
What about for bladder support?
So with bladder support, having the right balance in pelvic floor tension is really important. So quite often there is excess tension in the back and the rectal side and not enough tension in the front. So balancing those things is really important. So you're able to tighten around the muscles in the front of your pelvis, around the vaginal opening, around the urethra, and the bladder sling, the muscular sling that sort of lifts things up. And having a balance of abdominal wall and pelvic floor tension is really important. A lot of times when we have a lot of pelvic floor tension, it can make it hard for our body to develop enough abdominal wall tension, because your brain thinks, oh, I need core support. And your body's like, hey, no problem. Pelvic floor has this dialed in. And so your abdominals are like, sweet, I'm just going to chill out over here. And so then people are like working harder and harder to, strengthen their abdominals. But that message is getting hijacked and is getting shunted towards, how to clench their anus a little bit more. And you just don't get the message to the right area. And so the work is sort of hijacked. So making sure that you're able to effectively get your lower abdominal wall to perform with enough tension, so that you're not just narrowing your ribs and clenching around your anus, that you're really getting your lower abdominal wall tension, because that right above your pubic bone is where your bladder lies. And so we want those lower abdominals to have adequate tension to help support that bladder as well. And then, again, breathing, is really, really important to that. And so making sure that the diaphragm is interacting with the pelvic floor and the abdominal wall effectively.
Those are great tips. And also, I think too, like thinking sometimes people who have like maybe a little bit of incontinence or feel like they have an overactive bladder, then they're avoiding drinking water, and then they're getting dehydrated, and then they're going to end up with constipation. And like there's this gnarly little cycle that we get stuck into. So you have to address the root cause here instead of just band-aiding it.
Yeah, you're right. And what you just said makes me think that a lot of times having constipation will trigger urinary incontinence. And so like it can be a big driver of that. And so that exact loop that you just described is really common. And so people then don't want to fill their bladders because they're worried about managing it, but you need to have enough fluid to, make sure that you're able to have a proper digestion and elimination. And so like if we're constipated, that is a huge driver of bladder dysfunction.
So many good nuggets that I know I've taken away from our conversation. I'm sure our listeners have as well. So anything you want everybody to know before we part ways, and how can they connect with you?
Connect with me. You can come to Kinetic Physical Therapy or kinetic-pt.com at Kinetic Physical Therapy in West Seattle. And, we're on Instagram and Facebook as well, but direct communication is great. You can just reach out to me through the website. We can always have a discussion to see if what you need really lines up with pelvic floor PT or PT at all. We're always going to, make sure that we're a good fit for what you're looking for. Breathing is one of the most important things, and just really caring for your body and listening to what it's telling you and giving yourself the time and space to feel what's going on, and trusting yourself always. I find that people have the best and most accurate instincts about themselves. And that's a central point of how I practice, is like, I might have this piece of expertise, but I really need to listen to what people are bringing to me and trust them. And especially, well, all the time, but especially if people have been having complicated medical journeys and they've been bounced from one person to another and they've been dismissed and diminished in their care, I really want to listen to them. I really want to listen to the clues that they're telling me and the things that they feel they know, because usually they're right on. And whether or not I have a great explanation for it, that's for us to sort out together. But I really want to know what somebody's bringing to me, because they're the experts.
Yeah, such a great reminder. We are the experts of our own body.
Well, thank you so much, Fawn. I really, really enjoyed our conversation. Everybody give her a follow, connect with her if you're in person in West Seattle. If not, she does offer telehealth. So make sure to check out her website and reach out if you have any questions.
Thanks so much, Brandy.
Thanks for tuning in to another episode of Healthy Buzz. I hope this conversation has left you feeling seen, supported, and ready to take the next step in your health journey. Love what you heard? Make sure you subscribe to Healthy Buzz so you never miss an honest conversation. And if you found this valuable, please take a moment to leave a review. I truly appreciate it. For exclusive weekly tips and holistic strategies, be sure to subscribe to my weekly newsletter. The link is in the show notes. Remember, this isn't just nutrition, it's permission to trust your body. I'll catch you on the next episode of Healthy Buzz.